pandemics and epidemics of infectious diseases have devastated the earth on many occasions, killing millions of people at a time. Among the pandemics that have killed the most people in the human history was the Spanish flu in 1918, which broke out in Europe just as World War I was coming to a close. There were more people killed from influenza than the casualties of the First World War. After many years, there has been a remarkable progress in the prevention, control, and eradication of infectious diseases with improved hygiene and development of antimicrobials and vaccines. Despite these developments, infectious diseases remain among the leading causes of morbidity and deaths, especially in developing countries like the Philippines. Because bacteria and viruses evolve and mutate, in the past 3 decades, new diseases have emerged. In addition, epidemics of known infectious diseases, once considered in decline, have reappeared with increased frequency. Our country is very susceptible to epidemics of infectious diseases, with large numbers of people moving into crowded urban slums with insufficient sanitation, healthcare, and clean water. Epidemics could easily spread, difficult to control, and may result to a huge number of deaths. It is for this reason that the Department of Health has developed the Philippine Integrated Disease Surveillance and Response in order to address the threats of emerging and re-emerging infectious diseases. This is also in compliance with the revised international health regulations, requiring all countries to strengthen core capacities for surveillance and response. The primary aim of PIDSR is early detection of cases of infectious diseases. This is done so that control measures can be implemented immediately. By this means, the situation is prevented from developing into a widespread outbreak or epidemic. The priority infectious diseases and conditions monitored under PIDSR are the following. Diseases that are targeted for eradication, elimination, and other conditions of public health importance were also included under PIDSR reporting system. Under the PIDSR system, health facilities, barangay health stations, and other identified disease reporting units are required to report weekly cases of infectious diseases to the city or municipal health office. The report includes important information from each patient, such as name, age, sex, address, date of onset of illness, diagnosis, and outcome. However, diseases under Category 1 should be reported immediately within 24 hours. If this reporting procedure is consistently followed, outbreaks could be detected early. Once the weekly disease surveillance reports are received by the city or municipal health office, trained health personnel will encode the data into a computer. The data are analyzed to determine if there is a significant increase in the number of cases, suggesting an impending outbreak. The designated disease surveillance officer will immediately inform the city or municipal health officer for any suspected outbreak so that appropriate control measures can be implemented immediately. Disease surveillance reports received by the city are transmitted weekly to the next higher levels of the system. This is done so that the provincial or the national health departments can provide technical or logistical assistance to the local government unit. The local government units play a critical role in the early detection and response to epidemics. It is therefore necessary that each province, city, and municipality should have a functional PIDSR system. This means that in every province, municipality, and city should have an epidemiology and surveillance unit. The unit should have a trained staff, office space, computer, and communication equipment. These logistics will facilitate reporting, feedback, and data management. The cost for implementing PIDSR will have a definite return on investment. If epidemics are prevented, medical expenses and deaths are reduced, and the stability of the local economy is maintained.